Welcome to my channel. Subscribe to learn more about the active ingredients of the medicines. Today we will talk about the mechanism of action, side effects, dosage, interactions and warnings of promethazine. What is promethazine? Promethazine is a phenothiazine that, however, has no neuroleptic effects. It is an H1 antihistamine with anticholinergic, sedative and antifungal effects, with weak local anesthetic activity. It is mainly used to prevent dizziness associated with boat or air travel and as an antiemetic. Mechanism of action: the predominant action of promethazine is the antagonism of the H1 receptors. Although promethazine is classified as a phenothiazine, its ability to antagonize dopamine is about 1/10 that of chlorpromazine. For this reason, promethazine is not used as a neuroleptic. Like other H1 antagonists, promethazine does not prevent histamine release, as do cromaglicate and nidocromil, but it competes with free histamine for binding at H1 receptor sites. Histamine receptors in the gastrointestinal tract, uterus, blood vessels, and bronchial muscle are blocked by promethazine. Relief of movement-associated disease as well as nausea/vomiting appears to be related to central anticholinergic actions and may involve activity at the medullary site of chemoreceptor activation. Other CNS receptors may also be affected, as promethazine indirectly reduces stimuli to the brainstem reticular system. Sedation is significant at achieved therapeutic dose concentrations. The mild antitussive activity of promethazine probably results from anticholinergic and sedative actions. Local anesthetic activity requires higher concentrations than those required to antagonize histamine receptors. Pharmacokinetics: promethazine is administered orally, rectally, intramuscularly and intravenously. Onset of action occurs within 15 to 60 minutes after oral or rectal administration and within 20 minutes after intramuscular administration. After intravenous administration, onset of action occurs within 3 to 5 minutes. Antihistamine and sedative effects are maintained for 4 to 6 hours and 2 to 8 hours, respectively. Promethazine binds extensively to plasma proteins. It is widely distributed in body tissues and fluids, and it crosses the placenta and is excreted in breast milk. Metabolism takes place in the liver, with production of inactive metabolites such as promethazine sulfoxide and other glucuronides. The elimination half-life is 10 to 14 hours, with excretion of the metabolites in urine and feces. Toxicity: no long-term studies have been conducted to evaluate the carcinogenic potential of promethazine, nor have there been any published reports on its toxicity, reproductive effects or fertility. Promethazine is not mutagenic in the Ames salmonella test. Indications and posology: prevention of kinetic dizziness. Oral or rectal administration. Adults, 25 mg PO or prairie 30–60 minutes before departure, then every 12 hours as needed. Children over 2 years, half a milligram, kg, maximum, 25 mg, PO or prairie 30–60 minutes before departure, then every 12 hours as needed. The usual dose for children is 12.5 to 25 mg. Treatment of nausea/vomiting. Oral, rectal, intramuscular or intravenous. Adults, 12.5 to 25 mg every 4 to 6 hours as needed. Children over 2 years, 0.25 to half a milligram/kg, maximum, 25 mg/dose, every 4 to 6 hours as needed. The average effective dose is 25 mg. Treatment of allergic manifestations. Oral or rectal administration. Adults, the average dose is 25 mg PO or PR before bedtime. However, doses of 25 mg PO or PR can be administered before meals and before bedtime if necessary. Administration of 25 mg promethazine is sufficient to control allergic reactions that may occur in a transfusion. Children over 2 years, 6.25 to 12.5 mg PO or PR 3 times a day and before bed, if necessary. The maximum dose, usually at bedtime, is 25 mg. For induction of postoperative sedation, as a supplement to analgesics. Oral, Intramuscular or intravenous administration. Adults, 25 to 50 mg PO, IM or 4 in a single dose. Children over 2 years, 12.5 to 25 mg PO, IM, or 4 in one dose. For the relief of apprehension and to induce quiet sleep from which the patient can be easily awakened. Oral, rectal or intramuscular or intravenous dose administration. Adults, 25 to 50 mg PO, PR, IM or 4 before bedtime. Children over 2 years, 12.5 to 25 mg PO, PR, IM or 4 before bedtime for obstetric sedation. Intramuscular or intravenous administration. Adults, 25 to 50 mg IM or 4 during the early stages of labor and 25 to 75 mg once labor is established. Repeat every 2 to 4 hours as needed. Patients with kidney failure. No guidelines are available for dose adjustments in kidney failure, but it appears that no adjustments are required. Contraindications and precautions. Promethazine should not be used in patients less than 2 years of age because it can cause respiratory depression that can be fatal. Fatalities have been reported with promethazine use in children under 2 years of age. Precautions should be taken when giving promethazine to children over 2 years of age. The lowest possible doses should be used and concomitant use with other respiratory depressant drugs should be avoided. Phenothiazine derivatives lower the seizure threshold through their effect on GABA. Therefore, promethazine should be avoided, if possible, in patients with a seizure disorder or those receiving anticonvulsants. The anticholinergic activity of H1 antagonists may result in a thickening of bronchial secretions in the airways, aggravating an acute asthma or COPD attack. Because promethazine has significant anticholinergic activity, it should be avoided in those patients who have experienced a worsening of their respiratory status due to treatment with an H1 antagonist. FDA classification of risk in pregnancy. Promethazine is classified in pregnancy risk category C. In general, H1 antagonists are not recommended for use in pregnancy, especially during the third trimester, because of their risk to the fetus. Because there are no adequate studies in pregnant women, promethazine should be considered during pregnancy only if the benefits of treatment outweigh the risks to the fetus. H1 antagonists are not recommended for use during lactation, as they may induce paradoxical CNS stimulation in newborns or seizures in preterm infants. Breastfeeding inhibition may also occur. Alternative feeding methods should be used if promethazine therapy is necessary. Promethazine should be used with caution in children because paradoxical CNS stimulation may occur. There have been a number of cases of respiratory depression and sleep apnea in children who received phenothiazine antihistamines. The mechanism of this reaction is not yet known. Therefore, promethazine should be used with extreme caution, in any case, in children with a family history of sudden death or sleep apnea. H1 antagonists should not be used in newborns because of the possibility of paradoxical CNS stimulation or seizures. Promethazine should be avoided, if possible, in patients with open-angle or closed-angle glaucoma, and the use of an H1 antagonist with less anticholinergic effects is advised. Increased intraocular pressure may occur due to the anticholinergic effects of the drug, precipitating an acute glaucoma attack. Elderly patients are more susceptible to the anticholinergic effects of promethazine, including possible precipitation of undiagnosed glaucoma. Other eye effects resulting from the anticholinergic effects of promethazine include dry eyes or blurred vision. This may be important in the elderly and contact lens wearers. Promethazine has important anticholinergic effects, and a worsening of symptoms may be seen in patients with bladder obstruction, gastrointestinal obstruction or ileus, benign prostatic hypertrophy or urinary retention. The elderly are more susceptible to the anticholinergic effects of drugs as there is a decrease in endogenous cholinergic activity that occurs with age. Promethazine is metabolized extensively in the liver, and its metabolism may be reduced in the presence of liver failure. Patients with liver disease should be closely monitored, and dose adjustments may be necessary. Phenothiazine should not be administered to patients treated with metrizamide radiological contrast because of a possible increased risk of seizures. Phenothiazine should be discontinued 48 hours before myelography and should not be resumed until 24 to 48 hours after the procedure. Promethazine may cause drowsiness. Patients who received promethazine should be advised to avoid driving or operating machinery until they know the effects of the drug. Interactions. Phenothiazines inhibit and reverse the vasopressor effect of epinephrine. Therefore, if necessary in a patient who has received promethazine and requires a vasopressor agent, norepinephrine should be used. The anticholinergic activity of MAOIs is minimal, although anticholinergic effects sometimes occur. It is recommended that MAOIs should not be used simultaneously with drugs that have anticholinergic activity, especially atropine and scopolamine, as their effects and those of other anticholinergic drugs are potentiated and can become severe. Most authors recommend that antihistamine should not be used within 2 weeks before or after treatment with an MAOI. Depending on the specific agent, additive anticholinergic effects may be seen when drugs with antimuscarinic properties are used concomitantly. The following drugs that possess antimuscarinic properties and should be used with caution are atropine and other similar antimuscarinics, some H1 blockers, for example, carbinoxamine, clemastine, diphenhydramine, metdelazine, promethazine, trimprosoin, some phenothiazines, e.g., mesoridazine, promazine, thioridazine, trifluopromazine, some tricyclic antidepressants, e.g., amitriptyline, amoxapine, clomipramine, protriptyline, and other drugs with substantial antimuscarinic properties such as clozapine, cyclobenzaprine, and disopyramide. Drugs with lesser degree of anticholinergic effects include amantadine, bupropion, chlorpromazine, doxepin, imipramine, miprodiline, nortriptyline, percanamide, and trimipramine. Physicians should note that antimuscarinic effects can be seen not only on gastrointestinal smooth muscle, but also affect bladder, eye, and temperature regulation function. Because promethazine causes pronounced sedation, an additive CNS depressant effect may occur when it is combined with other CNS depressants including ethanol, barbiturates, anxiolytics, sedatives, hypnotics, and phenothiazines, opioid agonists, butorphanol, nalbuphine, pentazocine, tramadol, or other H1 blockers.